as being a participant, if you don't mind, you can put forward your college name as well. The rest of the participants, please put forward whenever you get an opportunity, just to put forward your college name also, by which it is our moral responsibility to thank your HOD, your vice principal and principals, maybe after this webinar series. Thank you from my side, and I would like to request my team to take up, please. Mrs. Grishma, please kickstart.
Good morning, a very warm welcome to all. It's a wonderful day and I feel privileged to extend my warm welcome to all presented here for our final day of state level webinar series on growth and development, a progressive advancement of little lives, hosted by Lourdes College of Nursing, Taliparamba, Kannur, in association with SNA North Zone. It's my pleasure to welcome our principal, Professor Sendil Kumar T. Today's resource person, Professor Dr. Priya Joseph, Principal, Little Flower College of Nursing, Ankamali. Our Vice Principal, come SNA North Zone Advisor, Mr. Johnson LK. Invited delegates, my dear colleagues and students. It's great delight to welcoming all delegates attending webinar series through Zoom and YouTube live stream. Let's continue our last day session of webinar series, Growth and Development of Adolescence. Adolescence is a period of developmental period during which dependent children grow into independent adults. This period usually begins about age 13 and lasts until the late teens or early 20s. It's a period of transition between childhood and adulthood. There is many physical, sexual, cognitive, social and emotional changes that happen during this time can bring anticipation and anxiety for both children and their families. Understanding about different stages can promote healthy development throughout adolescence and into early adulthood. Today also, we have an eminent personality and child health specialist as a resource person. It's a great pleasure for me to introduce our speaker, Professor Dr. Priya Joseph, who is going to talk to us about the growth and development in adolescence. She is currently working as a principal in Little Flower College of Nursing, Ankamali. Madam completed her post-graduation in child health nursing from Manipal College of Nursing and awarded PhD from INC Consortium under Rajiv Gandhi University. She has 22 years of professional experience in clinical, teaching, administration, and research. With great pride and honor, let me invite Professor Dr. Priya Joseph to take over the session. Over to you, Madam.
Thank you, Grishma. Thank you, Grishma. Am I audible?
Yes, Madam.
Okay. A warm good morning to one and all. Big thanks to the management, principal, and the organizing committee of Lourdes College of Nursing, Taliparam for organizing the state level workshop. Let me also add a word of gratitude to Professor Sendil Kumar sir, Principal, College of Nursing, Lourdes, Taliparam, for considering me as a resource person. And also, thank you for all the delegates who are attending this workshop. And all these days, all of you have been attending this webinar for the past 4 days, and this is the last session. And let us start with the topic. Adolescent growth and development. They are also our progressive advancement of little lives. Let's see, adolescence. Yes.
Excuse me, our slide is not visible. Please share this.
Okay. Is it visible?
Yes, ma'am, visible. Make it.
Yeah. I am doing it. Is this okay?
Yes, ma'am. Fine. Thank you.
Okay. Let us start. We are going to see today about adolescent growth and development. And here we can see that adolescence, it is a phase. It is a difficult period for those who are experiencing it. At the same time, it is an extremely difficult for those around them, particularly their parents. And this period was described by Stanley Hall in 1904 as storm and stress. Why it was considered as a period of storm and stress? Because there are mainly three reasons. One is conflict with the parents. Second is their extreme mood disruptions. And the third one thing is their risk behaviors. Now let us see the general characteristics of adolescence. It is a period of transition that is between childhood and adolescent. Until recent years, the adolescents were never considered either into the group of a child or an adult. And now recently only this importance came to this growth and development period as adolescence. And we can see that it is a time of profound biological, intellectual, psychological, and economic changes that takes place. Here, the young person who is very dependent on their parents, they now move to the independence and they develop autonomy and maturity and they stand alone as an adult. And at the same time, this transition period, that is not a linear progression. It is a multi-dimensional change that takes place in the characteristic of adolescent. They undergo a transformation and they change into a new person. Now for the important studies, we have classified into three phases of adolescence. That is biological changes and pubertal changes mostly happening during 10 to 13 years. That is the early adolescent phase. And mid-adolescent phase, that is increasing autonomy and self-discovery that takes place during this 14 to 16 years of age. And the late adolescent period, that is the formation of an identity. They stand out as a unique person. Even though we describe many of the characteristics that group the adolescents, we know that all of us are a separate individual with a unique personality and identity. The same way, adolescents, they move through this period and they develop into a unique personality or an individual. Now, in this session, we will see the physical and physiological changes, intellectual and cognitive changes, psychosocial, emotional, social, and spiritual changes of adolescence. First, let us see the biological development. The fundamental biological changes of adolescence that is collectively grouped or referred to as puberty. This actually includes the sexual maturation as well as the physical maturation. But many times we always coincide this word puberty with the sexual maturation only. But it has two dimensions, or it encompasses both sexual maturation as well as the physical maturation. And these pubertal changes, this is all under the influence of hormones, that is the hormones of the anterior pituitary gland that control all these pubertal activities. Now let us see one by one. And these hormones are mainly the follicle stimulating hormone and the luteinizing hormones. Now let us see the physical developmental characteristics. The adolescent body, it undergoes developmental change at any other time except from birth to 2 years old. The last sessions you have seen about the growth and development of infant, toddler, preschooler, etc. And we have seen that the tremendous changes in the growth takes place during that infancy period. That means a newborn baby who is unable to do anything capable, everything is done by the mother or the parent. They stand alone, or there is a tremendous, enormous growth that takes place during those 2 years. When we compare that characteristics to the other age groups, now you can see the most changes which happens also during the adolescent age group. And this developmental characteristics, it is mainly, there is a significant increase in height, weight, as well as the internal organ size and skeletal and muscular systems. These changes can happen in all these areas. Now, next is the sexual maturation. And this is also a pubertal changes. And here, there are two things that is happening. One is the changes in the primary sex characteristics. That is the genital changes. That is either as a male or as a female characteristics. And secondary sex characteristics, that is the breast development in girls and facial hair in boys. That is the sexual maturation. And the studies or the observations have shown that girls tend to mature 1 or 2 years earlier than the girls. Now let us see what is the hormones, under the influence of hormones, what is happening in the girls. Here you can see that in females, the luteinizing hormone that act on the ovarian follicles and production of estrogen. It initiates ovulation and formation of corpus luteum and progesterone productions. Next, in the male. Male also the same way, the luteinizing hormone is acting, that is acting on the testicular Leydig cells and promoting maturation of the testicles and testosterone production. And FSH, that is follicle stimulating hormone, acting with luteinizing hormone that stimulate sperm production in male. These hormones also not only acting on the primary and secondary sexual organs, it has also effect on the various other parts, that is skeletal, biological changes of various organs, including muscles, bones, skin, and hair follicles. Now, we have seen about the primary or the genital changes. Now, along with the pubertal changes or the sexual maturation, other body parts that also shows various changes. Now, let us see in males what happens to a boy, what is happening and how to deal with it. The main changes as a boy or a male person notice is changes in the face, that is acne, and there can be facial hair growth, even breast enlargement, not apparently as a female, but they too develop their muscular strength, as well as there are mood swings. And general, what we can see that they get more taller, their voice that deepens, Sweating starts, that armpit sweat, hair growth on the pubic areas, and penis and testicles get bigger, and in the face there can be pimples. That is the change that is seen in this boys also. Now coming to the girls, the body curve, that also is changing. The body attains more curves that of a female proposition. And the pubertal changes that we can see here, that is, they also grow taller, breast grows, hair grows in armpit, legs, between your legs or the genitalia, and armpit sets, and the menstruation starts, and they also may get pimples. That is the extra secondary maturation and characteristics which we can notice in this age group. This is in summary, that is both the group, that is the male as well as the female. They notice these changes. Weight gain in girls, it is mainly weight gain on hips and enlargement of breast and menstruation. And in male also facial hair and their voice deepens, and the testicular and penile changes. The primary sexual characteristics, that is also categorized using a Tanner staging, that is given a score from 1 to 5 of the 5 stages. We can see that in females, it is like the stage 1, there is no, that is the prepubertal stage, no terminal hair, appearance of breast bud, straight hair along the labia, and generalized breast enlargement and extending beyond the area, pigmented pubic hair, and nipple and areola, that is in the 4th stage, they mold around over the breast hair, increase in amount. And coming to the boys, in boys, the changes in the Tanner staging, what we will see is also the pubertal stage, first to 1 to 5 stages. And here it is a comparison that is of both the male and female, that is
Excuse ma'am, your mic is muted.
here we can see the adult size of proposition and appearance, both the male and female, they acquire by stage 5. This is a comparison that is shown for the male as well as the female Tanner staging. Now coming to the physiological changes, here we can see mainly all of the physiological changes they have by school age they develop, but here in adolescence also some changes also happens. They move to the adult levels, that is the size and strength of the heart, blood volume and systolic blood pressure increases, whereas the heart rate decreases. All formed elements of the blood, that is reaches to the adult values, serum iron, the number of red blood cells, hemoglobin and hematocrit in boys as well as in girls. Coming to the respiratory system, Here we can see the lung increases in both diameter and length during puberty. The respiratory rate that decreases steadily and it reaches the adult rates of 15 to 20 breaths per minute. Respiratory volume, vital capacity, and other physiological properties related to the respiratory function are also increased. Another thing which we will notice in them is the basal metabolic rate. The basal metabolic rate steadily declines from birth to adulthood and slows during puberty. A slightly higher metabolic rate in boys than in girls, that is due to the functional androgenic hormones. And coming to the skeletal system. The ossification of the skeletal system is incomplete until late adolescence in boys. It is more advanced in girls and occurs at an early stage. And the growth spurt, the muscle mass, and the strength increases. And the muscle development, it is usually greater in boys. One significant thing or the physiological change which we need to think about in this stage among the adolescent is that is the skin, the sweat glands and the sebaceous glands. Their skin that become thick and rough in adolescent ages, and due to the influence of androgens, the sebaceous gland become more active, particularly on the face, back, and genitals. Both sexes may have increased sebum production as there is increased level of testosterone, which may lead to the development of acne and oily hair. The exocrine and apocrine sweat glands function at adult levels during adolescence. The exocrine glands, which is all over the body, and they produce sweat that helps to eliminate body heat. The apocrine glands that is found in the axilla and the genital and the anal areas and around the breast. The sebum and the sweat that is produced also helps in emotional stimuli in both the sexes. Now coming to the motor skills. And almost all the fine motor and gross motor skills which we have seen by school age, it is developed. But the teenager also refines and continues to develop with their gross motor and fine motor skills. With regard to the gross motor, they have better coordination and they can involve in organized activities. They have increased concentration and they can follow instructions. Coming to the fine motor, they are able to use computers, able to manipulate objects, and their handwriting, which is neat, and their finger dexterity also improves tremendously. Now coming to the intellectual development or the cognitive development. The theory is proposed by Jean Piaget. The adolescent stage that is known as the formal operational thought. And in the formal operational thought, there are mainly their intellectual capacity, there is a change, and there are three things that is more important. One is reasoning skills. That means they are thinking about multiple options and possibilities. And they have also the ability to ponder things in a hypothetical way. What if, why it is. Those things they are capable of asking. That is their reasoning skill tremendously improves. The second thing is abstract thinking. What is abstract thinking? That means they can think about things which are not seen. That means or it is not seen or either not heard or even not touched. But they can imagine and think things which are very abstract, which are not seen or felt or heard. For example, the adolescent now can talk about faith or love, trust, belief, or spirituality, and even the higher mathematical functions. That is their abstract thinking capability. And the third thing is their metacognition. That means they think about thinking, metacognition. It allows them to consider how do they feel and what others do think about themselves and how they are perceived by others. These things, that is metacognition. So three aspects of the intellectual or the cognitive development of adolescent is reasoning skills, that is thinking about multiple options and possibilities, pondering things hypothetically, asking questions, what if, why. Second is abstract thinking, that is think about things which are not either visible, not heard, or not touched. They can think about those type of abstract things and they explain about religiosity, spirituality, etc. And metacognition, that is thinking about thinking. What means, what is their feeling? How do they feel? What others think about them? How do they are perceived by others? These are three main aspects of intellectual development. With this intellectual development or the cognitive development, what do they achieve? There are mainly things what happens with them is their critical thinking capacity that improves tremendously. That means, what is this critical thinking capacity? They can find out differences or exceptions or contradictions or the discrepancies. They critically see the things in a new way. And what happens with the adolescents is when this capacity is improved, they mainly go ahead with the critical of other people, especially with whom they are more comfortable as well as they are safe. That is mainly who will be their prey, that is the parents. They may not go with their critical argument with a teacher or a principal or whoever it is, or a higher authority, but who is ultimately their target, they becomes their parents. Their discrepancies, exceptions, and contradictory thoughts. Other aspect of their reasoning, their cognitive development is their creative thinking. That means they see things in a fresh perspectives or in a different angle, or they can even have they also have the ability to consider some things in a new way. That also increases or it improves the creative thinking capacity. Another aspect of it is their reasoning ability. That means they can their base deal with the things, how to deal with the things, their reasoning capacity that increases. And this reasoning capacity also leads to another problem is they start arguing with the people with the simple reason of arguing. They find out reasons. That is also seen in adolescents. One more important aspect of their cognitive development is their new ways of processing information. That means they can now deal with the more complex social issues. Maybe a schooler may not understand, they may not think, but whereas an adolescent, now when we talk about maybe Citizen Amendment Act or a farmer strike, those type of socio-political, ethical issues, they can take part in those type and they understand in better and they give their opinions. All those, it become a part of their development. So with the cognitive development, according to Jean Piaget, they are in this stage where they can have the critical thinking, creative thinking, their tremendous reasoning capacity, and they also process information in a new way. And once they develop this capacity, they are not only satisfied with that. Now they have passionately interested in that. Once they have developed, they also want to try it or use it. For example, now maybe as an old age person, we learn some new skills, maybe skating or maybe driving. So we are having the enthusiasm to try it or do it again and again for some time. So the same thing happens with the adolescents. What do? Their new skills, they even understand that they have this capacity, they want to do the experiments. So as again and again using, they level up the confidence. And many times what happens, it is not only it result in they have the success, also there is failures. Now coming to the moral development. This is, they are in the conventional morality, that is their stage of development. What is moral development? It is how they treat others. For adolescents, it is a choice how to treat or finding the right and wrong, or what is the value and what is the ethical behavior. Where what they have already acquired, or during the process they have the cognitive development, they can understand better way. So that also form a groundwork for their moral reasoning. They think about it, they better know about honesty, pro-social behaviors, helping others, volunteerism, caring for others. That all develops as a part of their conventional morality. And they don't just accept the parental advice or what do their parents say for them. They move away from the blanket acceptance or the blank acceptance of adult moral judgment, and they, due to their own personal values, they judge or see the things. But still many of the adolescents, what we can see is they usually embrace the values of parents or key adults. And they also tend to be more idealistic and possess a strong sense of fairness. This all many times end up in parental conflict. They will start questioning each and everything. Now coming to the sexual development, adolescent, we can see that they are in the stage of genital development. What happens here is the growing adolescent shakes off all the dependencies and learns to deal maturely with the opposite sex. When all other stages, they are either more dependent towards their father figure or mother figure or whoever taking care, those things. But now they shake off all those dependencies. Now they understand everything and they know how to handle with the opposite sex and their relationship that matures. Now coming to the psychosocial development. Here we can see that the adolescents or the teenagers are in the stage of identity versus role confusion. This is proposed by Erikson. It is one part of 8 stages of psychosocial development. Here the adolescent is in the identity versus role confusion. So what does it mean? Each and every growth and development stage, according to Erikson, what he says is there is a positive and a negative counterpart to it. And if the child successfully complete the positive counterpart of the stage task, they proceed to the next stage of development. So they have, when they reach the adolescence, many of their tasks they have completed, that is trust, autonomy, initiativeness, industry. Now they have to create their own identity. That is the positive aspect of psychosocial development. Everyone, each and every child, they want to develop their own identity as an individual. And if they are unable to develop that, there is role confusion that occurs. So what is the main, how do they develop that identity? In order to development identity, what they undergo is a process that is known as individuation. What is this individuation? Individuation means they move away from their parents. That is, as a child who was joined with the parent and family. Now the adolescent, they move away into a separate space, becoming a separate individual. In other ways, we can say that the individuation that has occurred. This is a part of their search for identity. Even though this does not stop with adolescent stage, it continues throughout the life of a person, but more pronounced during adolescence period. This identity development is more pronounced during the growth and development stage of adolescence. And they move away from the family. They find more importance with their own group or their peers. That process is individuation. And it is relationship, family relationships are disturbed. There is weakening of ties that was previously considered as important. Now for the child, more important is outside family relationship. And they move as an adult person of the society. Now, when we think about the identity formation, there are two concepts that is to be understood in the identity formation. That is, they have two things. One is self-concept and the self-esteem. What is self-concept? Self-concept is how do I value myself, or one person understand about themselves. What are their weaknesses? What are their good qualities or attributes? That means I identify myself as a person who is tall, short, intelligent, fair, whatever it is. Okay. And in all aspects, maybe in with the politics, religion, all activities, what are their values, beliefs, interests? What is our own understanding of oneself? That is the self-concept. Whereas self-esteem, that how do others value about our abilities. If I am good in singing and I sing well, but when it is told by someone else, my self-esteem increased. Yes, you are good in dancing, or you are good in speech. So that improves the self-esteem of a person. Here also in adolescence, in order to have the identity formation, this is very important, self-concept and the self-esteem. So self-concept can help you understand who you are and why you interact with others. And self-esteem means knowing you are worthy of being loved and accepted. So this is the main task of identity formation. These two things are important. Once they have the identity formation, it is not really they are limiting it. They started experimenting with it. That experimentation, it can be either in their experimentation of different ways, that is appearance, maybe sounding, or the way they behave. All those experimentation takes place with their identity formation. And each one approaches it in a different way. One may be important, showing more importance to their appearance, and there may be some activity, maybe drawing, singing, etc. So each exhibit in different ways of experimenting with their identity formation. Now coming to the spiritual development. We can see that they are very cool about their religious things. They started thinking, and they do not just accept the fundamental religious practices, or they do not cling to the religious practices. They are searching for ideas, and many exhibit intense emotions along with the introspection. They also think about those things. And many European cultures, and we can see, or the Western cultures, many of the adolescents even move to the Satanism because they feel there's something attracting them. But what is important here, it is if there is increased spirituality, morals, and family values, that helps in healthy behaviors, and decreased activities that can lead to risk-taking behaviors of an adolescent. Next is communication and language development. Almost their capacity for communication, language, everything is developed. How do they use it? That is, how do they establish interpersonal relationships, and how communication skills, how do they use it? More important in the case of an adolescent, how do they use their language. So it is continued to develop and it is refined during adolescence. They have good improved communication skills. They can use correct grammar and parts of speech. And they are also good in using slang language speech, that is colloquial speech. Now coming to the social development, that means as they grow into mature adult, their relationship and their span, that interaction span, expand beyond the family. Here it is more important what happens where their relationship with their parents and what is happening with also their body image and self-concept is also altered due to their social development, and they give more importance to the peers, and also the sexuality and dating is also become a part of their social development. So let us see first what is the relationship with the parents. The first look at itself, the relationship with the parents, majority of the adolescents, what happens, there is a conflict. That relationship, there is strain. As the adolescent of their identity formation, it is a part of their individuation. They move out of the family and spend most of the time with their peers and less time with the family and family's functions. So what happens? That itself create conflict with the parents. And parents sense that they have less influence. They do listen to their friends or peers more than them, the parents. And they started, as we have said, family values, and they become more independent, autonomic. Also, they have developed. So what happens? They more listening to the their friends and peers. So that gives a strained relationship with the parent and the adolescent. That again lead to family crisis, and the parents' response also may be something very not acceptable for the adolescent. And some of the parents, they become more strict and they limit their behavior. Again, that worsen the relationship. Whereas some parents, what happens, they become more liberals and they drop off rules. That also can have relationship that is badly affected. So when dealing with this adolescence, what is to be done? That is certain tips for the better communications, because there are emotional outbreaks that can worsen the relationship of the parents or someone who is in authority figure. So the communication aspect of adolescent and that authority figure is very important. Here, appropriate amount of time to be spent on discussing matters without interruptions and talk face to face. Be aware of their body language or our own language and ask questions to see how an adolescent feels, why they are doing something in that way. That is to be asked, and they to be more patient and to tell about their thoughts, and we have to choose words carefully that is understood by the adolescent. And the same time, the parents, they need to give, or the authority figures, they need to give praise and approval to the teenagers often during communication, and they should be considered as an equal. Don't talk down, so let them keep down. And the voice and our body language while talking with the adolescent is again important. And don't pretend you know all the answers. Admit that you too do mistakes. That is all important while we deal with the adolescent. And in case of family, setting rules and limits that should be fairly done. That is equally approved by the adolescent as well as the parent within the family norms. Now coming to the relationship with the peers. Their whole interest is turned outside the family to their friends and peers. So here there are two things that can happen with the relationship with the peers. That is, one is the significant positive effect of relationship with peers. That means it provides opportunities to learn about negotiating differences. It is a time for recreation, companionship, and someone to share their problems. They are equals. And they also learn loyalty from the peers or creating stability during transitions, during stress. And they are the someone who is safe to discuss their own family issues. Not only those things, it is a fun and excitement for the adolescent. So they also gather so much of information during their discussions and the activities. So it is a credible source of information and role model of social behaviors and social reinforcement for the adolescent, the peer relationships. But there is something which is negative also can happen. So what are the negative consequences of this peer relationships? That can cause involvement with the experimentation, that is alcohol, drugs, etc., as well as gang formation. These gangs, there can be healthy gangs. When we refer, it is not always they are having criminal activity. Those type of activity they can do collectively. So that is a negative influence of peer relationships. So the parents must know their teens' friends, who are their friends, where do they relate, where do they go. That is very important. And the parents should be also aware of potential problems while allowing them to a part of their gang or group. Next is, in the social relationship, another aspect is the concept of self. How do they perceive themselves, the adolescents? There are two important things. That is, one is personal fable, and the second is on the stage behavior. Now let us see what is personal fable. That means it is the belief that one's feeling and experiences are completely unique. That means they feel that they are beyond everything, nothing will happen to them. So what happens, like example, driving without following the traffic rules. That means they feel that they will never have an accident, or having sex without any protection. This all happens in the Western culture. Here also, in Indian culture also, we can see these accidents with adolescents without having helmet, or rash driving, or high speed bikes, etc. So because of their this belief, that is personal fable, it is belief that they are beyond something, that nothing will happen to them. That feeling of the adolescent, that also have problems in their social relationships. The second aspect is, that is imaginary audience. That means they feel that they are on the stage all the time and the people are watching them. Those feelings, on the stage feeling, and they have the imaginary audience. That means they have a heightened sense of self-consciousness, that imagine everyone is focused on him or her behavior. Here an example, a diabetic child may worry about injecting insulin at school because everyone will notice. These all are the factors. These two factors actually influence their social relationships outside the family. Next is changes in social cognition. We have seen that their cognitive development, they are now more creative thinkers, critical thinkers, and they can incorporate more new informations. That means that ability they are using in their social relationship also. That means they are better able than children to step into the shoes of others. They are more empathetic. They can take perspective because of their better understanding. They realize that other people have thoughts and feelings. However, they have difficulty of understanding what affects their own thoughts and feelings can also influence the thoughts and feelings of others that they do not understand. But their cognitive capacity or the intellectual ability is tremendously increased. As they move towards the advanced stage, they understand, older children, they understand the people's perspective in better than the early adolescents. Now they are able to discuss various issues, highlighting points of importance to people in various social roles. Usually they take up a cultural and ethnic role also based on their background. Now let us see the health promotion of adolescents. Now, adolescence is generally, they are considered to be a healthy period and there is minimal need for health services. That was the belief. Why it is so? Because in this period, not much of physical health problems, it is not seen comparing to any other age group. But what is seen in them is something very special kind of problems, are a peculiar gamut of peculiar problems not found in any other age group. That is parent-adolescent conflict, moodiness, oppositional and risk-taking behaviors. These type of behaviors are more seen in adolescents rather than the physical health problems. But still they are also vulnerable to other problems. It is classified into, they are because of the many rapid growth spurt, their physical, intellectual, emotional and social of growth explosion, this type of special peculiar problems are seen. Now we can classify those problems into physical concerns and behavioral concerns. The physical problems, it is not peculiar to other age groups. It is mainly with the adolescents. That is acne, motion changes, pineal problems, varicocele, epididymitis, testicular torsion, etc. in males. And coming to the females, menstrual disorders, dysmenorrhea, premenstrual syndrome, endometriosis, vulvovaginitis, etc. These problems are actually to be treated like a whatever is the underlying cause and the problem that is to be treated, and they need to give a education. Discussing each one of them is not in the our limit of explanation. So now I am moving to the next session. Whatever it is, these problems to be specifically seen as a health problem, and when they are approaching someone or a health person, how do they treat it? The adolescent, they should be provided with the privacy and confidentiality, and they prefer not having with their parents around them. And as a health professional, we should show concern for adolescents' perspectives. Maybe we may not feel very important having problem with the pimples, but for them it is a heartbreaking experience. So their perspective, and we should show empathy. And whatever explanations are given, that is should be in a non-threatening way. We should avoid assumptions, judgment and lectures. Long lectures, they are not interested. And whenever possible, ask open-ended questions and move to a highly sensitive issue only with the less sensitive issues. We should begin with the less sensitive issues because there are this menstrual problem or problems of male. These all are very sensitive, especially in our culture also. So we need not directly go to those type of problems. We should start with less sensitive issues and proceed to more sensitive issue. And here you can see from the word adolescent, the word, the problems. Yeah, they are very aggressive. They can have anemic, and there is problem with the abortion. That is teenage pregnancy, and they can land up such type of problems. And D stand for they are very dynamic and developing, and they can be depressed also. Or they are overconfident, overindulging, and obesity is another problem. L, that is loud but lonely, and lacking information. E, they are enthusiastic, explorative, and experimenting. S, social, sexual, and spiritual. C, courageous, cheerful, and they have concerns. E, they are emotional, they are eager and emulating. N, they are nervous, never say no to their peers. So this actually, there each one of these letters we can see there are certain behavioral problems underlying that can happen with the adolescents. Now we move on to that behavioral health problems. One of the behavior obesity, which has also another problems, we can see that that can also occur as a behavioral problem. This anorexia nervosa and bulimia nervosa, you might have heard. Here the genetic causes are there. Metabolic and endocrine factors can be there for the adolescent obesity. There can be some socio-cultural factors as well as there can be psychological factors. Whatever it is, the cause, there is a sequelae of events that adolescents develop poor body image, they develop low self-esteem, they can have social isolation, also feeling of depression, and they feel rejected. The management is the treatment of cause, and they should not be initiated with a reduction diet without health assessment, evaluation, and counseling. The various aspects of management is behavioral therapy, group and family involvement, whatever is the management. Another problem which we see among adolescents, that is suicide and substance abuse. There are various social factors, demographic factors, and the psychosocial and biological factors. That is social factors, limitation of smoking behavior. That means it is mainly in the substance abuse. They can have smoking and other drugs that is used due to the influence of peers and friends and mass media influence. Socio-demography factors, low socio-economic group, sex with the difference, that is male more prominent with abuse, other aspects with the girls, and when there is a problem with their performance in the school, that also can have an effect on those type of behavioral problems. And psychosocial factors, that is the personality, more vulnerable, they can have more effect of their peers and they get into this type of traps. And biological factors, low endurance, that means they do not once they smoke, they need it again, they have dependency, those type of things once they become addicted. So that is low endurance. And mainly this is all is to be treated with the special programs and special way of management. But all those program, whatever is the management, it is more important that in the adolescents we incorporate like school-based programs where their peers are involved, their authority figures are there that can be coordinated, and mass campaigns and skill-based programs. While we just teach them with the content, nobody is interested, especially adolescents. That is skill-based, activity-based programs are more important for the adolescents. Now, nurses' role, what happens in this is, when we as healthcare professionals, we know that we frequently come across with adolescents, maybe in hospital setting or clinic setting or a community setup. So as a nurse, we should understand the growth and development pattern. Then only we can intervene and communicate with this age group. And their behavior is unpredictable, that we might have seen. They can very emotional and outburst, any type of explosion can be there. They are very inconsistent with their need for independence and sensitive towards their feelings. They interpret situations differently from what they are. So we should be very careful as nurses to understand what is their developmental pattern. Why do they behave in such a way? And there are some programs when we plan that multiple groups address multiple issues. There are worldwide many programs for the adolescents, which all include multiple groups and multiple programs that is for the healthy growth and development, like sports teams in school or the community, peers, and involving peer programs, and teachers involved in many of the programs as guidance for the adolescents. And another activities among the peers like band and choir members, they when they incorporate it into those type of activity, they get better. And above all this, family support and their love will be more influential for the adolescent. The importance of the sports and physical fitness, they can better involved in team sports, which provide avenues for their exercise and release their extra energy. And at the same time, this type of sports activity that helps in reducing cardiovascular disease risk factors, and it also prevention against cancer, obesity, osteoporosis, and depression. And at the same time, it provide opportunity for the adolescent to interact with their peers and enjoy more socially accepted relationship with them. And when they are among their own group, they feel that they are having more respect with each other. And all these activities, the importance of school teachers, family is also important for the activities of adolescents. Then school-based programs, it has also has certain benefits, that is peer relations are there, their fitness can be improved, and there is family involvement and community relationship. All this is beneficial for the adolescents when it is a school-based program for their problems. And we have seen their motor skills and the fine motor as well as gross motor skills, they have increased tremendously. They can have better coordination and balance. At the same time, also their thought, intelligence, social activity, everything is increased. And that also can have some of the safety issues, that they can have unintentional injuries, which is the main leading cause of death in adolescents. We can see that accidents with the motorcycle, bikes, car accident, those type of activities, even going for swimming without any safety, those type of accidents are more seen among adolescents. It is not because of a health issue, actually they die. So these injuries, that is their impulsivity, inexperience, and peer pressure may place them teen in a vulnerable situation. And as already we have discussed, they have the invulnerability, personal fables, and imaginary audience. They feel that nothing will happen to them, which may also contribute negative outcomes. That's why they also indulge in alcohol and other drugs. And the common accidents, that is automobile, firearm accidents. So nurses must educate parents and adolescents on safety precautions, which is related to using these gadgets or activities. Nutritional aspect. The nutritional needs are increased. We have seen that there is an accelerated growth, physiological, all this that is needs their energy that is to be met. They have the need for increased calories, zinc, calcium, and iron. It also depends on the teenagers. Now let us see what is to say for an adolescent girl of 13 years. What is her perspective on health? We talk about so many things, their growth, their development, their health issues. But in the word of an adolescent girl, you can see here, when she was interviewed, what she said, what is the meaning of health? So her answer is, you want to do things, to live, to get out, to have fun and be active. That is actually the meaning of health for an adolescent. That is very important when we have interaction with these young ones. So taken into those type of aspects, World Health Organization and around the world, we can see that there is a proposed activity which is termed as life skill education. So developing life skill is an important aspect of adolescent health promotion, and it has various activities. It is a skill training program that helps the adolescents to have a personality or a better personal identity, having better decision-making capacity, and this have those skills actually taught them communication skills, interpersonal relationship skills, decision-making, problem solving, creative and critical thinking, etc. And along with that, they also, this awareness program or a skill training program is also target the emotional aspect and coping with emotions and stress of adolescents. It is a worldwide program that is utilized mainly for the adolescent. And there are various programs including GAP program, adolescent depression prevention program. Those type of many programs are available for all those more beneficial, and it is proved to be effective. That is the life skill program. That is skill-based program. In order to, it is not focusing on a particular problem. It is the overall development and helping the adolescent to develop into a healthy person or a adult person who is capable and very productive. That is a multi-based target, that is approach. They are using it in the life skill education. Now, let me conclude with this. According to Aristotle, who stated that youth, they are heated by nature as drunken men by wine. Whereas Socrates, he characterized youth as inclined to contradict their parents and tyrannize their teachers. And the turbulence of adolescence may not be visible always. However, it is beyond doubt that is a period of storm and stress. It is a natural period of uprootedness in human life during which inner identity is to be achieved. And during this identity crisis, there is a thread of catastrophe, but it can be a turning point also. So with better discipline and a healthy behavior, they can have successful individuals. Let me conclude that when the Alexander the Great, all might have heard, when he started to conquer the world, he was an adolescent. And many of the sports persons, eminent persons, if you are seeing, they become more successful during this adolescent period. So it is a period of life which can be molded into a very healthy and productive. They can produce. Actually, we can shape them into a healthy and productive adult. Thank you.
Thank you, Madam, for delivering to us such a remarkably outstanding presentation. During adolescence, young people go through many changes, not only physically, but emotionally and intellectually. Although it can be a period of conflict between parent and child in terms of these transition stages. So this session helped us a lot to learn about the adolescent's growth and development. Grateful to you, ma'am, for your mind-blowing session. Now it's a time for question and answer. If you have any queries regarding this topic, you can ask. The platform is yours. Any queries? Now I would like to invite our principal for concluding note.
Again, very good afternoon to all of you. I would like to thank Professor Dr. Priya Joseph for accepting our invitation and spending her valuable time with us for more than an hour for this session on adolescence, which is one of the important topics under growth and development. And thank you very much, madam, for being a part of us for this webinar series.
Thank you, sir.
Welcome. And I feel like we had a great success of webinar series for last 5 days. We are going to end today, and I'm really glad that this success is because of not by ourselves, by Lourdes College of Nursing, Kannur, or by the resource person, but this is because of the patient listening by all the participants. Consistently, we would see around 500 to 600 people who are either in Zoom or YouTube live watching. Like that is the strength for us, always mentioning that like that is a strength, like we are going ahead with the different kind of programs during this COVID-19 pandemic. So the real the acknowledgement and the thanks notes goes to the especially to all the participants from various College of Nursing. So it is not only for the participants, I also would like to send a thank note to the HOD of Pediatric Nursing and to the Vice Principal and Principal of the following Colleges of Nursing. They have a very active participation for last 5 days based on our invitation. Includes Vellalar College of Nursing, Erode, Tamil Nadu, Little Flower College of Nursing, Angamali, Ernakulam, VCF College of Nursing, Kottayam, Ashwini College of Nursing, Thrissur, Seventh Day Adventist College of Nursing, Vattapalam, NS Memorial College of Nursing, Almas College of Nursing, Kottakkal, PRS College of Nursing, Tejaswini College of Nursing, TMMM College of Nursing, Tiruvalla, Malik Dinar College of Nursing, Kasaragod, Anjarakandi Medical College, College of Nursing, Kannur, Samaritan College of Nursing, Ernakulam, Hina College of Nursing, Bishop Bensigar College of Nursing, Assisia College of Nursing, STA College of Nursing, Sion College of Nursing, Shanti College of Nursing, Calicut, SH College of Nursing, Vidyasagara University, Almas College of Nursing, JDT Islam College of Nursing, Calicut, Sam College of Nursing, Bhopal, Father Mullah's College of Nursing, Mangalapuram, Mother College of Nursing, Thrissur, Saraswati College of Nursing, Andhra University, Narayana Hridalaya College of Nursing, Medical Trust College of Nursing, and Siddhartha Hospital, and Westford College of Nursing, Thrissur actually. So I extend my wholehearted thanks to all the principals of this college, especially they given a special permission for their students to continuously attend this session. So that is the great motivation for us to take up this continuous session from on behalf of my team. So I'm really happy to put an end note that we are on a great success path, especially by joining hands with the Student Nurses Association of North Zone in Kerala. Also, I would like to extend my acknowledgement to especially my management, especially to my director, Mrs. Raki Joseph. She's the backbone. She's always the motivator for all our events. Also, I would like to thank my vice principal. He's the great brain under this journeying of all these programs, and the HOD of Pediatric Nursing, Mr. Sriraj, and the joint secretary of this program, Mrs. Shurya, and those who have been chaired the moderator job for last couple of days by Mrs. Grishma and Ms. Jasna and all. So thank you all of you for joining hands together to making this event as a wonderful one. Also, I would like to end note with, as we promised, we mentioned that like these on sessions will be awarded with KNMC credit hour, but yesterday only I got a reply from KNMC that the KNMC has declined credit hour, that means not sanctioned the credit hour because of the new guidelines issued by INC related to online webinar series. That means they are expecting all the events to be happen in a single day. As you guys know, that is not really possible in terms of growth and development, because if we deliver all this 5 session within a day, probably you will be out of control. So that is the reason why we conducted this as a webinar series. So that's the reason why, like, NMC has announced that they would not able to sanction the credit hour. If at all they can able to award only 1 credit hour, but that will not yield any fruitful results. But anyway, I thankful to the registrar for her effort in her side to making a convey of this message to us. So sorry about that, because we could not able to achieve this time. Maybe next time we will work out rightly. Also, I would like to mention many of the participants has requested for the content. Actually, again repeated, it is not every normal human being having only 40 minutes of attention, including myself. But the session sometimes the sessions were so lengthy, and there is plenty of slides. And probably you may need these slides for your future references also. If possible, we may send it through your email. If not, like, all our 5 sessions will be recorded sessions will be available in our Lourdes Education Academy YouTube channel. So wherever you have a query again onto the same growth and development, you can visit our website. All 5 series will be available. You can just go through wherever possible, whenever possible. You can see it once again. So thank you from my side once again. And like, it's not my thanking note, but like, I would like to acknowledge and declare that concluding this webinar series as a grand success one. Also, I would like to mention, not last but not least, like mentioning the effort taken by all the 5 resource people who have been taking a time and effort for preparing it for a week time and coming for a session. I again remember them, thanking every one of them. So thank you once again, and giving a wonderful opportunity to our Lourdes College of Nursing, Talipiramba, Kannur, for making this webinar series as a grand successful. Thank you.
Thank you, sir. Let us be grateful to the people who make us happy. They are the charming gardeners who make our souls blossom. Now I invite Mrs. Varana Patmajan, Assistant Lecturer, Lourdes College of Nursing, to deliver the vote of thanks. Over to
Mrs.
you.
Grishma and Varana, please hold on. If any participants, if you would like to speak, or if you like to give any response through us lively, it will be great actually. Like, we are looking forward your response, because all the time we are speaking, but we would like to hear from another end also. Like, if somebody would like to say something, you are most welcome, because we are happy to note from you as well. And I said, we are not only sanctioned KNMC credit hour, but the participation e-certificate will be delivered to every one of you. Those who have been submitted feedback form, all those will be getting an e-certificates for this participation of this webinar series. I'm looking for anybody who can able to say a few words to us, please, from the participant side, either the faculty, student. We are glad to even listen from student also, or the staff nurses. Please, you are most invited. I know there are many big personalities inside as a participants, but it will be great for us to listen from the participant side.
അവിടുത്തെ വിശ്വസിച്ച് അവിടുത്തെ കരുണ ആഗ്രഹിച്ച് ജീവിക്കുന്നു. അവിടുത്തെ മക്കളെ കൈപിടിയിരുത്തി എന്റെ മാതാവേ.
Marilyn, who is that Marilyn? Please kindly switch off your microphone. Anybody would like to say anything, please? That will be great motivation for us, because we just, teaching and learning is a two-way process. It should not be end with only side, the teaching side, but also from the participant side. Anybody would like to make any note to us, please? Deviga said, thank you, Deviga. You put a message to us. Bobina baby. Anybody from Anisha Victor raised hand? Please, Mr. Johnson, give an option for the participants to answer, please. Anisha Victor.
It is enabled and they can answer. They can.
Anisha Victor, you raised hand. Please, you can switch. You can unmute your mic and you can speak. Anisha Victor raised hand continuously. If you want to talk, please unmute your mic. You can talk to us, please. or anybody else, we don't mind, but we would like to hear from you, please.
Sir, hello.
Yes, please. Yeah.
This is Hina Haidar. I'm an associate professor in NS Memorial College of Nursing. The sessions were very wonderful. Actually, we as a faculty also, we learned so many things apart from daily we are teaching our students. So it was a wonderful session although, and we want to say that these type of sessions can deliberately tell us that how we have to overcome the doubts of our students also. So many students have so many doubts regarding growth and development, and as a teacher I find it out that we will not get enough time to clear all the doubts. So these sessions can took an advantage to our students. So thank you from innermost part of my heart that these sessions had given a positive attitude to students also. Thank you, sir. And thanks to all the organizers.
Thank you very much, Hina, for giving a wonderful feedback onto the webinar. And like, I'm sure that as a principal, I have enjoyed, like, we have studied everything, but like this is time at least we can patiently sit and we can listen and we can and understand all the concept in growth and development. That what said, it is a wonderful opportunity for even not only for the students, but also for the faculty members. Thanking you to have a wonderful note from you. Anybody else? Hina, where are you from? You are from?
I'm from NS Memorial College of Nursing, sir.
Where is it actually? NS in the Trivandrum side, isn't it? Trivandrum?
No, sir. It is in Kollam, nearby
Kollam,
to our
okay, yeah.
bypass route.
Fine. It's in Kollam actually. NS I have heard, but thank you. And
Thank you very
much.
It is a body from NS Cooperative Hospital.
Okay, fine. So our regards and thanks to your principal for permitting you guys to attend. Thank you. Okay.
Thank you, sir. Thank you.
Anybody else? Would you like to share anything?
Hello, good morning, sir.
Yeah, very good morning. Who is that?
This is Sheena Sisani, a student from Ashwini College of Nursing.
Yes, Sheena, happy to hear from you. Yeah.
We are really thankful for organizing such a wonderful seminar, and this have advantaged us a lot. And we would like to thank our principal and vice principal for allowing us to participate. We're so thankful. Thank you.
Thank you, Sheena. Thank you very much giving an feedback and convey our acknowledgement to your principal and vice principal also. Okay, thank you. Anybody?
Hello, sir.
Yeah, please. Yes, please go ahead.
My name is Joslita and I'm from Father Muller College of Nursing, Mangalore. This webinar session is very good and very informative for us. And thank you all the organizers for giving permission to participate as to the session. It is very effective and very informative, sir. Thank you.
Thank you very much for giving a nice feedback. Anyone else? Anyone else is getting ready to make a few comments? And Mary Michael, would you like to talk to us? Bobina.
Hi, sir. Hello.
Yes, Bobina. Yes, Anne, please talk.
Sir, myself, Anne Mary Michael. I am from LF College of Nursing. I would like to thank all the organizers of this webinar and all the research persons who talk and who teach about the growth and development. It was a wonderful section. Once again, thank you all.
Oh, thank you. Thank you very much. Okay. So anything else? Shall we go for winding up? Anything else? Anyone, would you like to talk to us, please? Okay, fine. We are winding up. Anyway, once again, I thank Professor Dr. Priya Joseph for being joining hands with us. Thank you, madam. And Mrs. Grishma, please move ahead. Thank you.
Thank you all for your responses. Now I invite Mrs. Varuna Patmajan, Assistant Lecturer, Lourdes College of Nursing, to deliver the vote of thanks. Over to you, Varna.
The essence of all beautiful art is gratitude. Good afternoon, everyone. Respected dignitaries, dear colleagues and delegates. I, Varna Padmajan, takes the opportunity to put my gratitude into words. First of all, I would like to thank Almighty God for making today's session a great success. On behalf of Lute College of Nursing, I would like to extend my heartiest gratitude to our Honorable Speaker, Professor Dr. Priya Joseph, Principal, Little Flower College of Nursing, Ernakulam. Thank you, Madam, for your wonderful session on growth and development of adolescents. We are thankful for your time and efforts made towards make it a memorable one. Your lecture was inspiring and motivating, which helped us to improve our knowledge about the topic. Thank you, Madam. And also, I express my heartfelt thanks to our principal, Professor Senthil Kumar T, who is the backbone of our institution, for his support and guidance. Thank you, sir, for assisting and encouraging all of us. I thank Mr. Johnson LK, Vice Principal, Lute College of Nursing, for his unparalleled support to make this webinar successful. Thank you, sir. My heartfelt thanks to Mr. Sriraj Aran, HOD, Child Health Nursing, and other HODs and the faculty for their valuable contributions, guidance, and encouragement in all our efforts. Now, I would like to thank all the delegates for your active participation and timely attention throughout this webinar. Thank you, one and all. Thank you.
Thank you, Varna. I hope all of you had a nurturing experience throughout our webinar series. Your active participation makes our webinar series a resounding success. We are expecting the same for our forthcoming webinars. The e-certificate will be issued to all participants, those who submitted the feedback form for all sessions. Thanks and regards from Lute College of Nursing. Thank you.